Hello, and thank you for joining. I'm Hollie Hennessy. I focus on IoT cybersecurity here at Omdia. I'll be around after this snapshot session to answer any questions you might have, and if not, my email address is on screen if you want to contact me at a later date, and my Twitter handle is there if you'd like to connect. So firstly, I'll just go over an agenda of what we're going to be speaking about today. We've got the IoT in healthcare, explaining a bit about the different devices and the growth in the Internet of Medical Things. Then the impact of cyber attacks. This includes past breaches, known attack vectors, and the impact on patient safety. And finally, we'll move on to risk assessment and how businesses can deal with the threat landscape. So first of all, Internet of Medical Things devices, IoT. So these fit broadly into two different categories. You have at-home devices and in-hospital devices. At-home devices might include things like blood pressure monitors, blood glucose monitors, cardiac monitors, temperature monitors, but also things like digital pill dispensers and sleep therapy devices. And this is without personal medical and healthcare devices such as fitness trackers and heart rate monitors and things like that you might have on your person. Hospital devices include things like health hubs, which connect different things together, medical tablets that are specifically designed for hospitals, emergency response systems that may be connected, defibrillators, pumps to administer medication, and sensors that look at temperature or various other environmental factors. So the Internet of Medical Things. IoT benefits many industries. It can improve efficiency, processes, cut costs, and in healthcare, it's really attractive because it can give healthcare professionals access to data that might be very difficult to access otherwise, and they can do this quickly and easily with IoT devices. And with this, IoT provides a real added benefit of improving and streamlining patient care, which is obviously so important. And with COVID-19, patient care has really seen a shift to remote monitoring rather than traditional in-hospital patient-doctor appointments. And that's alongside various lockdowns and with hospitals being overwhelmed with the amount of patients with the virus that they're needing to treat and help recover. So these devices, the Internet of Medical Things, have been on the rise and over the last couple of years, and they look to grow even further following the recovery of the pandemic. So I've got some Omdia data here on the right-hand side. At the top here, it's just a little snapshot focusing on cellular devices, which you can see at the bottom, the different types. And I've got the module shipments there. And from 2018 to now, you can see a growth, and this looks to project this growth into the future. You can see 2023, this is still continuing to rise. Below this, I've got a graph focusing on IoT cybersecurity. You can see the different verticals below. Medical is here in pink. And again, over the last couple of years, there's been growth with medical. You can see the pink chunk rising in size. And up to 2025, this is looking to significantly boost in the next few years. And by 2025, the pink obviously represents quite a significant portion there. And we estimate that's around almost 39 billion by that point. So healthcare breaches, I've got some statistics here to talk through just to give you an idea. So according to the HIPAA journal, the average number of breached healthcare records in the US per month is more than 3 million. And up to this point, almost 40 million healthcare records have been breached just in the last 12 months in the US. But it's not just a US problem, it's worldwide. So there's a couple of things that have happened recently in New Zealand and Ireland, healthcare attacks and two ransomware attacks that you may have heard about in the news. And on ransomware, my colleague Tanner Johnson will be speaking today, so make sure to check out his talk. But yeah, these two attacks were quite troubling for the healthcare organisations. So in New Zealand, the hospital had to resort to pen and paper instead of using their IT systems and accessing data and online patient records. And while there was no kind of critical care scenario which was interrupted at this point and no loss of life, it just really does show the impact on the hospitals here. And in Ireland, it was a bigger attack. You can see here by these headlines, it's been deemed catastrophic. It's 10 days after the attack and they're still struggling. Some other things come to mind. There was this article about a young girl who's having to now travel across country for care where she would otherwise get it close to home. And these kind of examples here just kind of show the real chaos that this kind of attack can bring about. And luckily, while this hasn't resulted in any loss of life directly related to these two examples, it very well could have done. And if you think to just a year ago at the height of the COVID pandemic, when hospitals were overwhelmed with the number of patients and healthcare professionals were rushed off their feet, something like this and the chaos that this could bring about at that time, if they coincided, could be really damaging, and there could be a lot of life lost. And with these examples, they're not specifically IoT devices as the attack vector. IoT devices can be compromised, and I've got some examples here of device compromise with Internet of Medical Things. So firstly, there's an example with insulin pumps. Back in 2019, experts found a vulnerability which could allow them to either give too much insulin, which could really severely harm somebody, or not give insulin when it's necessary. And there was an FDA issued warning at the time. Similarly, with vitals monitors, part of the device could be inoperable, so it could mean that a doctor or a nurse can't actually use the device and get the information that they need. Or the data, quite worryingly, could be manipulated, meaning that a doctor or a nurse could be relying on this data when it's not quite correct, and they might deliver the wrong or incorrect care that they would otherwise be able to give. And this third example, quite worryingly and quite scary, in my opinion, is with pacemakers. So slightly different to the other two devices, pacemakers can't just be changed, removed, updated physically as quickly as another type of device as they're inside somebody's person. So in 2017, there was 465,000 pacemakers recalled because of quite a horrible vulnerability, which could allow battery draining, changing settings, or even the beat of the device being changed, which could kill somebody. And luckily, these things haven't happened. There hasn't been a malicious actor who has done this to somebody. But the case is that this is a possibility and that these vulnerabilities do exist. And with the growth of the Internet of Medical Things, it just looks to continue, and it really shows that this needs to be looked at. So who's responsible? So first of all, device manufacturers, they really need to ensure security by design as a first point of call. With IoT devices in particular, they're often made without security in mind. So it might be that the functionality of the device is at the forefront. It might be that they don't have the relevant security professionals to focus on security. It may be that pushing the device to market is far more important for them and their highest priority. And there's various regulations and guidance at the minute around the world. As an example, in the UK, there's Secure by Design, which looks to have guidelines and necessity for smart devices, but not necessarily medical. And in the US, there's federal devices, but again, not necessarily medical. It seems to me that that is the next step. If it's to follow suit, medical devices need to be looked at next. And I wouldn't be surprised if there's regulations around this coming around soon. Especially given what we just spoke about, the impact that a breach could have on a hospital and healthcare professionals' workloads and the individual patient and their health and life. So risk assessments need to be formed in these scenarios, and constant patching and firmware are necessary. There needs to be continuous conversation and communication between manufacturers, people using the devices, and those implementing the technology in a healthcare setting, while looking at all the wonderful benefits that IoT can bring about, also really need to address and assess the risks too. So risk is calculated by looking at the likelihood multiplied by the impact, and then you can get a figure for risk, and this can help to apply security controls. So you can see a graph, a chart just down below here with different colors, and it allows the categorization of risks and whether they're high or low, and then you can focus on the risks that are highest now and then leave the others till later. So when looking at a risk assessment model, it's the impact, I think, that's really important in healthcare, and potentially different factors need to be looked at. Usually with impact, you may be looking at financial impact, operational impact, regulatory impact. Then you may look at leaking of personal information, but with medical, there's also going to be medical information that could be leaked. And also, as we spoke about earlier, the validity of the data transmitted by the IoT devices is important. When we spoke about the vitals monitor potentially delivering incorrect data, that could be used and it could result in the loss of life potentially. It could result in the patient's health and safety being at risk. And looking to the right-hand side, we have the cybersecurity triumvirate of integrity, confidentiality, and availability. And integrity really does stand out here. healthcare professionals need to be able to rely on the information that they're using, and patients also need to be able to trust the healthcare professionals as well. And both parties need to know that there's nothing that's going to negatively impact their health or safety. So overall, these assessments need to be done prior, during, and throughout the implementation of the Internet of Medical Things. So thank you very much for listening to my snapshot session. If you have any questions, I'll be around afterwards. And my contact details are here if you want to get in touch. Thank you very much.